got my coffee, my water. What makes me really nervous is when I see people on their phones, they're either bored or they're tweeting something very negative about me. So it'd be nice when I look up not to see you on your phones, please. So thank you very much for the introduction. No, I think I'm a note taker, but again, I'm Yannis Mameletzis. I'm from WHO headquarters in Geneva. We have a very active PrEP team at headquarters. This PrEP team sits within the key populations and prevention team in the HIV department. We essentially take the evidence, formulate guidelines, and do technical support to countries that are keen on implementing PrEP, or they're not keen on implementing PrEP, but we're there to ensure that we're raising awareness around this evidence-based intervention. So on another point, I really just want to, quite humbled to be here. Thank you to Gus for inviting WHO to present really a bit of a landscape on where things are with PrEP globally and also in Europe. So let's get things started. I've also been petrified because I have about 70 slides to go through 20 minutes. I have no financial conflict of interest to declare. And I'd like to give you two case studies. Bring you back 20 years ago, 1988. Madonna was still married to Sean Penn, and the guy to the right is Eddie the Eagle, represented Team GB in ski jumping. And in that year, I'll bring you to the island of Crete in the village called Sfakia. We have this guy called Odysseus in sort of American English, who was 18 years old, felt quite repressed in the village in a very homophobic environment, and moved to the big city of Thessaloniki that year to study. He didn't know much about HIV prevention. He was having quite a lot of fun, and in 1992 was diagnosed with HIV. 20 years later, when everybody loves Netflix and The Crown, we have another guy called Kostas, who also from the same village in Crete, 19 years old, also felt quite repressed in that community and moved to the big city of Athens. He knows a little bit about HIV prevention. He recognizes kind of condoms are very effective, but he struggles with them. He has an iPhone and has heard about PrEP through Grindr. So he takes the initiative and goes to his doctor and wants to learn more about PrEP. And he's told to just get away, use a condom, and he feels quite judged. A month later, Kostas comes back to the doctor with a bottle of generic PrEP, which he purchased from some website, which came from Thailand. And then he comes back to the doctor with information. Information is power. And he says, listen, doc, look, WHO even recommends this, has recommended oral PrEP since 2012. And there's even a tool that they worked the better part of 2 years, which they published last year. And wait a minute, I even read information that was targeted for me as a PrEP user. And there's even information for you as a clinician to read about PrEP. And this was also, was based on a meta-analysis, a systematic review and meta-analysis of all the clinical trials. And this, of course, work was peer-reviewed and published. So clearly, you should act upon the fact that there is this evidence-based intervention. I have the bottle of pills in front of me, and I want to keep myself HIV negative. So we have a guy here who is well-informed, genuinely wants to keep himself HIV negative, has had an alternative way of getting drug, but he doesn't have an informed healthcare provider. Now, this is very much the scenario in many Western European countries, and I would imagine in the South and Eastern Europe as well. So the big question is, we have global evidence-based guidance, and why the hesitation? So over the course of the next 2 days, we're going to be talking about the bottlenecks, the barriers. They're well articulated in the literature. From whatever setting you are in, whether it's in Scotland or out in Asia, there's many of us well recognize what those are. Cost always is the one that is comes up first. But of course, from the perspective of a clinician, of a potential PrEP user, there's uncertainty over certain clinical outcomes. Well, what about STIs? There are concerns around the development of drug resistance in people that don't actually adhere to PrEP and then may get HIV infected. This was articulated in the previous speakers. There's a lack of awareness amongst providers, lack of awareness amongst policymakers, and there's a lot of misinformation out there. And of course, the treatment gap is not a myth, but it's a reality in many settings, particularly in Eastern Europe. And of course, there's moralization. We're just, as somebody a colleague of mine at WHO, I don't know if it was Roslyn at UNAIDS or somebody at WHO said, it's not a vote winner to stand up for key populations. And this impacts, how governments actually think about PrEP in their sort of overall HIV response. There's a lovely paper that Sheena McCormick published in JIAS about 2 years ago, a commentary on the barriers and also opportunities for PrEP in our region. And I just want to kind of speak to the issue of cost. At the top line here, this is MSF data. We have this is data for low middle income countries. The originator product since 2005, 2006, you pretty have like a flat line in terms of cost for that product. But of course, we have generics in the equation as far as particularly in low middle income countries, and the cost is down to 64 per person years of cost in USD. So moving on a little bit about the epidemiology, we have some bad news. From the HIV surveillance report, this is a WHO ECDC report. We've seen the trend since 1986. Unacceptable rates of new HIV infections. The green line is the WHO European region, which encompasses not just the EU countries, but an additional countries, namely Eastern Europe. And you can see the epidemic in some ways is plateauing, but if you actually look at in the particular countries in Eastern Europe, epidemics are still on the rise. So obviously it's being offset by the declines in Western Europe. I prefer maps because here you see the burden of disease in Russia, Ukraine, and other countries in the WHO European region. And of course, it's not just about new HIV infections, but one of the biggest challenges to the epidemic and the response in the region is the fact that we're having people being diagnosed late with HIV infection. And so, just pointing to this table, if you look at by transmission mode, you have the West, the center, the East, and the EU countries there. And for sex between men, at times take data with a grain of salt. That 3.7% for the East is a bias. People don't disclose the fact that they have gay sex in so many of these countries. And so I think that's an eyesore right there. I noted it, brought it back to WHO Euro. I'm like, what is our official position as WHO on this? But obviously, it's safe to say that that 3.7% is a gross underreporting. But let's have hope. In Greece, we have an expression: you don't want your mother-in-law to be called Hope Elpida because she dies last. And so, first and foremost, we have civil society. We have I would argue actually that it's obviously civil society groups, advocates that are pushing the agenda, and we in the public health space and the policymakers are lagging behind. And we have sort of shakers and movers here who've done very creative things to ensure access to PrEP. And so we have the evidence base, we have the strong science, but it's important to recognize that we have bold activism. And we have generic and originator competition now into place. France, importantly, in July of 2017, they announced at the International AIDS Conference, they moved from the originator product to actually procuring 5 generics into their program. And so clearly there's a political will, within the ministry. ED is a very strong presence in the country. Not everybody has an organization like ED in Europe, but it's important to see that rapport that happens between civil society and government. And so they moved quickly to ensuring, for the purposes of their program, that they would procure these 5 generics. And what's nice about France is that this is always listed online. Gilead Sciences is filing in low middle income countries to get a prevention indication for Truvada. We keep tabs on where they're filing, and this is sort of the latest update from January of 2018. And this is where the originator product has been registered for PrEP as of this month. If something is a bit sort of odd, we communicate with obviously manufacturers to ensure that we have the most accurate data. It's important to note, sorry for the busy slide, but on the left column, we have 10 companies at WHO that are pre-qualified. So 10 generic companies for which their product is pre-qualified. When we're talking to countries, we point to the column to the left, but we also try to tell them there's also the reality on the right. So these are the actual products that countries are considering or are actually using in their national programs. So this is generic tenofovir, emtricitabine, generic manufacturers to the right. And again, France being fabulous, they actually have their generic products and the originator product in there that's been registered in the country for PrEP. Another facilitator, as I mentioned, we have the clinical guidance. And at WHO, for the European region, we have a regional action plan where we are explicitly prioritizing PrEP. And of course, we have a wealth of information on the web for people who are interested in PrEP. So it's a shout out to Prepster here. But it's critical when you're engaging with your stakeholders in country to actually, now we're seeing some real life success data out of the RCTs into with programmatic data on the impact of PrEP. This is San Francisco data from 10 minutes I have. Okay. This was published a few months ago, the City Health Department in San Francisco. Clearly, it's, and Gus made a point to this, it's not just PrEP that is driving down the curve, but there's a whole infrastructure of services, expanding HIV testing, doing targeted testing, and of course treating people, upon their diagnosis, linking them into a quality treatment and getting people to become undetectable quite quickly. And so San Francisco is the laboratory of all these wonderful things, which we refer to, but when obviously we're talking to a country that has very limited resources in Eastern or Southern Africa, this is where we'd like them to get. But this is, we can say this is the gold standard. San Francisco started doing same-day ART long before, others did. But it's safe to say that, PrEP had a role in 2012, FDA approved Truvada. You start seeing that decline in new HIV infections that is reported to the City Health Department. So PrEP is a catalyst and a key element to drive down new HIV infections. I also show this slide now because I think in this, so we're talking about combination prevention, testing and treating, which really drives down the curve. But in Australia, and this is data for New South Wales, you see in March of 2016, so the blue line that oscillates up and down up there are the new diagnoses amongst MSM. And in 2016 of March, you have those 59 cases, and then you start seeing that that decline in the next few quarters. Importantly, Andrew Grulich and his team will be presenting an update to this data at an oral abstract in a few weeks in Boston at CROI. The UK data actually came before. Gus showed the Dean Street data, but I believe Will and others will comment on this, so I didn't want to show that. So, it's a boring slide, but actually it's a very exciting initiative at WHO. Our UNAIDS colleague talked about the Global Prevention Coalition. And when that was created, I wasn't paying attention to that, and I put into a grant, and we got money from UNITAID to establish the Global PrEP Coalition, because I just felt, well, we need some sort of platform mechanism to ensure that there's a bit of like south to south, north to north, north to south collaboration, that we're not reinventing the wheel. We have a lot of tools that are out there, and so in line with the work that AVEC is doing with PrEP Watch and a bunch of other partners, we've kicked off the Global PrEP Coalition as of last year, and we really are trying to support regional efforts in coordination. I was just a few weeks ago in Bangkok for a regional consultation. Will Nutland was also there with me, and the idea is to support the efforts, and Thailand, Vietnam is moving next with PrEP in the region, and those early adopter countries supporting other countries.